Welcome back. We are still in the introduction part of this course on back pain, and sometimes you're going to see my face, sometimes you're not. In this module, you're not going to see me. It's just easier for me to record these things without having to worry about my camera and what's going on behind me. So when we need to see me and I need to demonstrate or get my emotions across to you, you'll see my face. Hopefully you don't mind. So what we're talking about right now is how I want you to know whether this course is going to help you or not immediately so that you don't have to waste your time. And I'm always, every time I'm in a course or a presentation or a seminar, I'm always thinking, is this for me or not? And is this going to help me? So we're going to lay that out right now. And this course is going to be for you. We talked about this earlier, but we're just reviewing in these first couple slides. This course is for you if you want to not be dependent on other people. When you have back pain, pain in general makes you not be able to do things like you normally can do in life. I was there before. I couldn't put my shoes on, couldn't put my socks on, could barely put my pants on, and couldn't do any housework or yard work, or I could hardly even sit in a chair. So you become dependent on other people. I remember when I had my back issues, I was towards the end of my undergraduate college days. I couldn't even go to class because I couldn't walk down the stairs that were in my apartment. I couldn't sit in the classroom. I depended on people in the class to bring me my homework. I mean, it was ridiculous. I depended on my wife to put my clothes on, and this lasted for months and months, actually almost a year. So this is for you if you want to no longer be dependent on other people. If you're thinking to yourself, will this ever go away? This is for you. It's going to go away. Back pain goes away. 99% of back pain goes away if you do the right things. The key here is the body is designed to heal itself naturally. The body is designed to heal itself naturally, but the environment has to allow for healing. So we're going to do our best today and throughout this course to talk about the environment and help you optimize the environment so you don't have pain, so you can move again without pain, and you don't have to rely on medications, injections, and surgeries, and you can stop getting treatments that are only altering your problem, like medications, like injections. Those aren't fixing anything. I argue that surgery doesn't fix anything either. It only fixes the structural damage that occurred, but it doesn't fix the cause of the damage. So if you think this is never going to go away, this is absolutely the course for you. If you're thinking you need surgery, I would take this course and do this complete course until you ever consider going under the knife. Again, my personal experience, and I've seen many other people where surgery only provided temporary relief, and then everything, all the pain and the disability came back. Dysfunction, I should say, came back. Statistically, we'll talk later on about what science and research says about surgery, and it's going to be pretty nasty. Not the best outcomes. About 50% is what we'll talk about. So flip a coin. This is for you if you can't exercise. And you want to be able to exercise because you know that exercise helps your health, the rest of your health, your heart, your body, your mind. This is for you if you're afraid of moving the wrong way and you don't know what to do. This is going to help teach you what movements to do, what treatments that are most successful to allow natural healing. It's going to help you take care of your family again if you're out there struggling with that, and being able to be the provider. This is also for you if you want to be independent, you want to gain knowledge, you want to avoid surgery, you want to learn what to do, and ultimately you want to learn how to heal the body naturally, avoiding medications, injections, and surgery. And really, I think I highlight this several times as I believe that all of us want to be able to move again without pain. That's why we're all here. And so let's focus on that. It's not good enough to just to put you in a position and say, okay, it doesn't hurt, so now just don't move. Or to tell you, if golfing hurts your back or walking hurts your back, it's not good enough just to tell somebody not to do that anymore. We want to learn how to do those things in life again. For me, it was golfing, bike riding, and running were the things that I wanted to get back to. And I'm able to do all those things today. This isn't for you if you're looking for a quick fix. Nothing in this course is going to be magic that all of a sudden just a light bulb goes off and everything's gone. The things I'm going to teach you, not only do they take the time to learn, like the information and the ideas, but then you're also going to gain tools and strategies to implement so that you can make a change in your body naturally. Those things take time, and we'll get to that, how much time, but none of this is going to be a quick fix. If you're forced to be here, and so if you have a spouse or a friend or a doctor, somebody made you buy this course and watch this, then this is probably not going to be for you. If you're only interested in pain relief and you want to just continue to mask the symptoms, that's not what we're going to talk about. We're going to actually talk about how those things aren't a great idea. And then it's not for you if you just want to do surgery and you haven't tried other things. So if that's you, this is probably going to be a waste of time. But I'm pretty sure that most people that are listening to this are very motivated. They've probably tried a lot of the things that we just talked about, and they're really looking for that permanent solution, or long-term solution, I should say. So how do I know if I can help you, right? And that's the thing. You're thinking that right now. I'm sure you are. And so I'm used to that. I meet people on a daily basis that walk into my clinic, and they're asking me the same question. And so we are a privately owned company, and we rely on successful results. We rely on people getting pain relief from their back pain. And so we're always trying to think, all right, when I first meet you, if I don't help you and I waste your time and your money and your energy, and you don't get relief, or you don't meet the goals that you have set for yourself, then that's going to negatively not only affect you, but us as well, because you're going to tell everybody you know about how awful the experience was. And so we have a test that we give people. We pride ourselves on 85% success rate. So the patients that walk in the door, we track all this information, and 85% of people that come to me and my staff meet their goals. So they graduate with goals met, and usually the most common goal is pain relief, right? But also things like movement, activities that they couldn't do, now they can do. So 85%. So how do we get such high results? When you compare that 85% to surgery, which is barely reaching 50%, most studies show 40%, which we'll talk about, as well as injections around about 50%. And we know that medications don't fix anything. And so how do we get such good results? And the test that I'm going to give you right now is part of that. So I want you to think about, before we get into all the great information in this course that starts to get into strategies, I want you to think about to yourself, what are the activities that cause you the most pain in the last 2 to 4 weeks? So I want you to think about that. And maybe even writing this down would be a good activity for you. I would encourage you to have some notebook as we're going through this course to keep track of all the information I'm going to teach you. But there's going to be notes in this course as well you can download. But for you to just identify, what are the activities right now? So what activities? Is it walking? Is it standing? Is it bending? Is it squatting? Is it putting your pants on, putting your shoes on, laying in bed, sitting in a chair? What is it for you that causes the most pain? Okay, so now that you've got that in your mind and you've written it down, how bad was it, or is it? And I hate the pain scale 0 to 10, but for this sake, it's easy to identify, 10 being the worst pain, 1 being, or 0 being no pain. What's the most pain that you felt in the last 2 to 4 weeks? How bad was it? So 10, some people are probably thinking 11, 12, 20, 100. Now you have just identified that, okay, if you came up with an activity and an intensity of that activity or that pain, you just passed the test, which is you identified a movement that caused pain, and it increased the intensity of your pain, or it just became painful. That's an important step. And so that's how we know if we're going to be able to help you, because if your pain is reproducible with movement, we know that we can reduce the pain by improving the movement. It's a movement-based problem. Now, on the other end of the spectrum, if you have pain that's constant no matter what you're doing, and being honest with yourself, a lot of times people tell me that, oh, I have pain all the time, but yet they can find positions of comfort. And so that means it goes away sometimes. And so that's not true. If it goes away sometimes and it's not constant, that's still a movement-based problem. And so if it's a movement-based problem, this is going to help you, because we're going to go through movements in areas of the body that are moving wrong that are causing your back pain. So you're in the right place. If you can identify an activity that causes more pain and positions or activities that cause less pain, then we're going to hit this right on the head. Most commonly what I hear is this is a list in order. So walking is the most common, standing, sitting, sleeping, putting on your shoes, bending, twisting, working, laying down, raking leaves, and shoveling snow if you live in the Midwest, like I do, unfortunately, here with the winter time outside my door. Although the sun's out today, which is nice. We'll take it. Comes out like once every 10 days here in the winter. Got to take your vitamin D. Get your exercise. Okay, so you're in the right place. Now, I want to highlight that I'm going to teach you the process, the Superior process, the process we use at Superior Physical Therapy to help thousands of people. And you're going to hear from some of those people, and you can read about those people. You can watch videos on our website, and it's powerful stuff. I mean, it's the stuff that helped me. So there is a bright future if you follow the process that we're going to lay out, step by step. This is going to be a good thing. It's going to allow you to sleep better. Sleeping better allows for better moods, right? Better moods allow for better relationships. You're going to be nicer to the people around you. Less pain allows for more movement, and more movement improves overall health. And that's really an important thing. I think people don't realize that when you have back pain, you're not moving, you're not exercising. And we know that when you're not moving and exercising, you're being sedentary, you're increasing the risk for heart disease, diabetes, obesity, and depression. Major health issues. And so again, that's not good. We don't want that. We don't want you to have heart disease in 15 years because you have had back pain that hasn't gone away because you haven't found the problem and actually gave your body the chance to heal itself. And there's also a bright future if you do this process, the Superior process, the Superior back pain relief process. You're going to have less doctor's visits, medications, surgeries. It's going to go away. You're going to be like me. You're going to be like the patients that we see on a daily basis that 85% of the time meet their goals. Now, if you stay in the same path and you don't follow, none of this is guaranteed, right? I can't guarantee you that you're going to have the same outcome that I had or the patients that we see here, because I don't have control over what you're going to do with this information and these strategies and techniques. It's up to you. And so there's no guarantees with any of this stuff. I mean, unfortunately, that's just the way it is. It's up to you to take the steps that we're going to lay out. And so if you don't, and you stay in the same path that you've been on for months, weeks, years, maybe, the list of things you can't do because it hurts is going to grow. You're going to have a bad mood all the time. You're going to be depressed. You're going to have fatigue. The people around you aren't going to like being around you. Your overall activity level will decline, and your risk for major health problems is going to increase. And the likelihood of you having a high-risk procedure, which is a surgery, grows every single day that you live. This is an error. It should say back pain. Sorry about that. It's going to increase. We don't want that. So stay tuned. We'll be back. This is all the introduction to this course. You're going to do well. You're going to follow our process. And I look forward to seeing you in the next video here.